अभी मेनोपॉज इज सो मच यू कैन से ओवरलुक. लॉन्जेविटी दे दिया आपने. अब एक फीमेल मेनोपॉज हो रहा है 48 इयर्स में और जिंदा है वो 88 इयर्स तक. 40 इयर्स शी इज लिविंग इन मेनोपॉज. पहले शी वाज डाइंग एट 50. शी डिड नॉट इवन नो व्हाट मेनोपॉज है. अभी हम ये कहते हैं ये तो मेनोपॉज वगैरह तो लाइफस्टाइल का प्रॉब्लम है. लाइफस्टाइल का प्रॉब्लम नहीं है ये लॉन्जेविटी का कॉन्सिक्वेंस है. Why we always blame the lifestyle for everything? When we have no answer, तो पाकिस्तान ने करा दिया. सारी बारिश बहुत ज्यादा हो रही है, पाकिस्तान की साजिश है. तो वही हमारे साथ होता है. When we have no answer, everything is attributed to the lifestyle. लाइफस्टाइल इतनी बुरी होती है तो लॉन्जेविटी का अप्रोच हम कभी पहुंचते ही नहीं. आप बताइए मेरे को, अगर लाइफस्टाइल वाकई में बहुत बुरी होती है हम लोगों की सो कॉल्ड, तो क्या हम लॉन्जेविटी अटेंड करते हैं? लॉन्जेविटी तो अटेंड कर रहे हैं ना. ये डूइंग इट. How can we say we have everything is a bad lifestyle? The only thing is we are not able to find answers to this, and we are not able to solve this problem because we are still so much inclined to treat only the clinically proven diseases. तो जब आप ये इवैल्यूएशन करते हैं मैडम, तो आपको क्लिनिकली प्रूवन डिजीज मालूम पड़ जाती है, आपको सब क्लिनिकल केसेस मालूम पड़ जाते हैं, आपको वो केसेस मालूम पड़ते हैं जहाँ पर आपको कुछ इंटरवेंशन करना ही नहीं है. आपको साइकोलॉजिकल केसेस मालूम पड़ जाते हैं वेयर योर साइकियाट्रिस्ट कैन हेल्प यू एंड इट्स अ ग्रुप एफर्ट. सो आई कम बैक टू द मेनोपॉज पार्ट. सो 40 years you live without hormones at all, and it's a proven fact that if you initiate HRT, see all the complications after menopause, right? Angioplasties and what not. And female has made, nature has made female very strong, but only before menopause. After menopause सब कुछ लेता है nature. लाओ ये सब वापस करो कि तुम्हारा काम, तुम तो फैक्ट्रीज है, बच्चे बन गए, पैदा हो गए, तुम्हारा काम खत्म हो गया. But we are living till 90 or 100. We will be living till 120, 140, 150. How can they live like this way? Forget about other HRTs. Anti-aging में अगर हमने मेनोपॉजल HRT को ही मैनेज कर लिया ना, I think we will still do lot of a big thing for the mankind.
But sir, at menopause also we have to do investigations. If hormonal level is normal according to age, then we are not supposed to.
No. There are different levels actually. Estrogen in a menopausal female, not on HRT, is less than 30. On HRT, we want it to be 120. That's a target on HRT. 110, 120.
No, but suppose if we do reports, they have mentioned menopausal, premenopausal.
हाँ, menopausal देते हैं ना वो. Normal का मतलब क्या है? Normal का मतलब है जो population में prevalent है, that is normal. What is the normal height? What is the normal height? Normal height.
5'5".
और 5'6" वाला यूएस जाके बैठेगा तो नॉर्मल है?
No.
ऑस्ट्रेलिया जाके बैठेगा नॉर्मल है?
India.
It is because it is prevalent. This is the most common height found, so उसको नॉर्मल माना हुआ है. Simple.
Lab reports what
Lab
they
report,
mention normal is.
Lab report is a population study always.
Okay.
कि out of the 100,000 sample collected of menopausal ladies, उसमें से 96% लोगों का लेवल इनके बीच में है. So therefore it is normal. But the question is, these levels are not defining the symptoms of what patient is having. पहली बात. One. तो वो normal है, कोई मना नहीं कर रहा, हम भी नहीं मना कर रहे. तो normal क्या था? Less than 30. What about 0? 0 is also less than 30. So therefore the new reference range, they say that menopausal is less than 30. Menopausal on HRT is about 120, 130. You have to maintain that level of 120, 130 when you are talking about HRT. Okay? तो ये हो गया मेनोपॉज. अब हम दुनिया भर के एंटीएजिंग की बात कर रहे हैं. बहुत सारी चीजें हमारे हाथ में नहीं है because it is lot of investment to really make something like that. कि एक आदमी आपके पास में आया और आपको उसको रिवर्स एज करना है 15-20 साल. You need all of these things. You need HRT. You need first is you need the clinical evaluation, then you need the lab evaluation, then you need the intervention part. Intervention part can move from anywhere. It can have homeopathy inside, it can have allopathy inside, it can have ayurveda inside, whatever is proven. But mote तौर पर you are managing the neurotransmitters by whatever means. Let it be yoga, let it be meditation, let it be supplementation by the pharmaceutical agent, let it be supplementation by the food nutraceuticals, let it be by the counseling, let it be by the professional counseling, let it be by the occupational counseling. One part. Hormones, again, you have to see the level of the hormones, you have to relate the level of the hormone with the symptom of the patient and whatever issues patient is having, whether patient is really having any issues or not. Then you have to read about the complications of the deficiency or excess of those hormones. And then you have to manage those hormones either by physiologically or by pharmacologically. Physiologically, you can always do it again by simply neurotransmitter control or de-stressing and all those things, yoga, meditation, whatever. Pharmacologically, you can take care by HRT. HRT, again you can decide which HRT you want to go. You want to go with the oral HRT, you want to go with the transdermal HRT, you want to go with the injectable HRT. Whether you really want to go with the pharmaceutical HRT or you want to go with the nutritional, so food and all those nutritional part, soya and all those things. Decision completely lies on you, right? After that, you have to take care of the inflammation part. Inflammation part is the third component of aging. Now, inflammation, you have to find out whether patient, you don't have to find out. Every individual is inflamed. And we are born, we are going to be inflamed from inside because that is a part and parcel. Hearing and tearing तभी तो होगा, नहीं तो मरेंगे क्या करके? जब inflammation होगा नहीं तो मरेंगे कहाँ से? So inflammation is definitely there, but is the extent of inflammation is more than the repair. That you have to take care. And for the anti-inflammatory, you have to manage the atherosclerosis of the patient. Whatever, again for that diet, exercise, statin, or any other lipid lowering agent, nutritional aspect of nutritional approach to manage that lipid thing, other anti-inflammatories, right? And one of the best anti-inflammatories is exercise. Got it? Then comes like so-called, if somebody is really interested to do all that, which are not proven, chelation therapy and ozone therapy and all those. But now this menu is very big. Okay, and the fourth comes is oxidation. We all know oxidative damage is happening. For that, definitely you don't have to test for it. You just have to go for an antioxidant, whatever. Now oral antioxidant, inhalatory, whatever. Okay, ozone. Now oral one. Again, exercise. Go for a vacation. Go on a hilly area. Pollution-free environment. Again, here also chelation to a certain extent. Not proven, but still something is better than nothing. Sort of phenomenon. Your spa therapies, aroma therapies. All of them are helping you in your all four components are taken care of. With all this, now बहुत बड़ा अलग कार्ड हो गया ना. What to choose from it? That as a physician you have to choose. यहाँ पे दो लोग हो गए, एक physician and the patient. So you have everything. Now what that patient, like a hospital is having everything. Now अभी हमारे पास में एंजियोग्राफी भी होती है, एंजियोप्लास्टी भी होती है, CABG भी होती है, क्लिनिशियन भी होता है. अब मुझे क्या चूज करना है? मुझे पेशेंट को बताना है कि भाई ये है चार चीजें, आप मुझे लगता है ये बेस्ट है आपके लिए. But you can still choose because we are not treating any big disease. We are just trying to make a patient anti-age. Clear? The choice is completely, the decision is between you and your patient.
Still, for sir, menopause, if lady is coming, suppose at 45-50, one lady is totally asymptomatic, one lady is symptomatic, all the symptoms of menopause and everything. We will investigate both the levels. So hormonal level is almost same. But who will require treatment?
Symptomatic requires, symptomatic definitely treatment should be given, definitely should be given. Asymptomatic, again, between you and the patient. I'll show you something. ये मैं बंद करता हूँ, मैं आपको एक दिखा देता हूँ. A good presentation. Yeah. Yeah, perimenopausal is definitely a candidate for HRT. Definitely. Actually, there is a time to start with. So I will simply just go with this. This I actually prepared for try to let's revisit the menopause HRT theories. Okay. This is what we always talk about WHI, HERS, and nurse studies and all those. They were the proven risk and benefit in those studies, which are again now we have rejected them completely. Okay. If you see this estrogen progestin therapy and estrogen therapy alone in the WHI study. अगर आप देखेंगे तो only estrogen I am talking about. The benefit stroke में the risk is 11. And the CHD there is a clear benefit with the odds ratio of 3. Venous thromboembolism and colorectal cancer. So these are the benefits. Cancer, neck fracture, any other fracture. So osteoporosis is a clear benefit of the ERT in any of the study. Okay? Coronary heart disease, progesterone का थोड़ा problem है, but estrogen has shown the benefit. And breast cancer, contrary to the previous belief, actually,
Now it's benefit.
got it? Again the same thing here also. If you can see the hazard ratio, so wherever it is less than 1, it's beneficial. Okay? So if you see coronary heart artery disease 0.95, breast cancer 0.8, hip fracture, any fracture, okay, diabetes, done. Only estrogen part. Same here. You already have all this in the printout or the first lecture. Okay.